To treat the four sites of the psoas muscles successfully, you must be able to position the AcuLever with total confidence. In this video, we will focus on how to position the tool and your body correctly, and how to move seamlessly between the first three sites. Of course, it is imperative that you hit the first site correctly to begin this sequence. To do this, you must handle the tool using your fingers as guides for the correct positioning on the first site. Hold the AcuLever in your hands like so. Your pinkies will be touching the interior tip of the blade, and the outer ridge of your hand will run parallel to the blade. Orienting your grip on the tool like this will assist in proper placement under the body. To set the blades of the AcuLever into the first psoas site, you want to aim the outer ridge of your hand so it makes contact with the outer ridge of the hip bone, or ASIS. From this perspective, you can see the outer ridges of the hands making contact with the hip bones. Now let's move on to positioning the body. To create space for you to situate the AcuLever properly, you will want to form a triangle with your knees, hips, and chest. If you aren't very flexible, don't worry. Even a small triangle between these 3 points will work. Lower yourself from all fours to the triangle position. Reach under your hips for the tool with your hands with the correct grip. Note, with the correct grip, the outer ridge of your hands will form fit into the crease of your hips. Slide your legs back and lengthen them. Bring your hands underneath your chin and rest for a moment in this position, acclimating yourself to the pressure. The blades of the AcuLever are now in the first psoas position as you begin leg rolling side to side. To execute a tool-assisted stretch, bend your knees, driving the tool deeper into the psoas muscles. Walk your arms further out and really extend your feet backwards. This should drive the tool deeper into the muscles as you begin leg rolling again. Your leg rolling should accelerate slightly in speed as you continue to work. To execute a tool-assisted stretch, bend the knees and lengthen your body by extending your elbows. Moving seamlessly between the first and second psoas sites is easy. Just push yourself back up on all fours and walk your knees back approximately an inch. Lower yourself again, this time directly onto the tool. You will repeat everything done at the first site, leg rolling and tool-assisted stretch. This second site is more challenging with the pressure that the tool is creating. It is recommended that you spend at least 2 or 3 sessions working on releasing the first site before moving to the second site. Once you complete all of the treatment techniques on the second site, move to the third site by repeating the pushback, knee repositioning, and body lowering. Likewise, you should spend at least 2 or 3 sessions on the second site before advancing to the third site. The pressure that the tool places on the third site is rather uncomfortable, but very beneficial in releasing your hips and low back. Always use the AcuLever with caution and stop any treatment that feels too uncomfortable.